Okay, it's recording now. Okay. So, ladies, this year we spent a lot of money, and I wanted to know if you guys have any ideas on how we can drop down some of the costs and some of the things that you were wasting a lot of money on.
Okay, I think the first thing that we gonna think about whenever we talk about cost containment, that is gonna be like how to save the sterile package. So, for example, like our like IV sterile package. So like whenever we use it and then we miss the van, so we gonna like use a different package. So it means like we're gonna like waste a lot. So I think in order to get it like to improve it, so we get like more training regularly
Right.
for like how to get the IV done regularly. So like the skill getting better, and so they can bring down the cost for the sterile package that we want to save.
Okay. Okay.
Another one is about drugs. There is a lot of expenses that is incurred at the hospital when it comes to drugs. And as nurses, there are ways we can minimize those expenses. One of them is majority of the time as nurses we go pick drugs, just take to the patient, and we fall some on the floor. We really need to come up with strategies so that whenever we pick them, we just take it to the patient without falling on the floor.
Right.
One of them is maybe keeping up with the record on the drugs. We get it and give it to the patient so that they will know there is nothing that fall on the floor.
Right.
Another one is giving education to the nurses to know the importance of not wasting the drugs at the hospital.
Okay.
That way they will save the hospital expenses of buying more drugs.
Okay, so you guys have some really, really good ideas.
How about you?
One of the ideas that I had was that we educate our nurses on not wasting PPE equipment, maybe going in there and having all the things they have to do for that time frame and getting it done instead of going in there several times to do different things that they could have done all in one setting. So that was something that I thought was important, and especially educating them, being that PPE equipment is several things: gloves, gowns, the covering for the shoe, like it's a lot of things that are being wasted in that process. So I was thinking if we could save on that would really help for this year.
Yes. So you mean like we need to get everything, like get like preparation, good preparation, like with everything before we get
Go in there.
Prior
That's
to
a good idea.
procedure.
Yeah, I mean, since we can only focus on one thing this year, I think we should take a vote on what we feel is more important, whether it's the drug or whether it's the sterility or the PPE equipment that we should vote on. What do you think?
I think the PPE is the good idea because the PPE we use for every single room, for every single patient, or every single time that we enter to the patient room. So I think that is the like most important. That is basic, but that's important.
Yeah.
So I think that is the good.
So
idea.
your vote is on PPE?
Yes.
Okay, and yours?
I support him too.
Okay.
It's the same thing because daily we are having patients on isolation, and we use those PP all the time.
Right.
And majority of the time, as I'm at the hospital, I see some nurses, they go there, get in a PP, throw it away, go back, get one. So I think PP is the best.
Okay, so I think we just gotta go ahead and educate our nurses on the PPE equipment, and also, do you guys have any questions or anything?
So I have one question, like, what if, like, they don't follow the education that you has been telling them about PPE?
Well, that's when accountability comes into play. We as nurses, we are practicing patient-centered care, and I believe that we should hold each other accountable. So if you see another nurse going in a patient's room and you see them going there about 5 times, and there's this rule that we're trying to cut down on cost, and you see them wear 5 different PPE equipments to go in and out, you stop that nurse and remind them. Sometimes people don't remember, what they've learned, and sometimes people forget. So you remind them.
Yeah.
So we hold each other accountable, and I think that's how that problem will be solved. And
and that's what we call teamwork.
yeah.
That's good.
Yeah.
Okay. Do you have any other questions?
So far, I think what we've discussed about is
So we're gonna do the cost containment on the PPE.
yes.
Okay.
And I hope it's
Yes.
gonna work and it's gonna be reduced the cost containment for this year.
Okay.
Do you have a time frame for that? When
At
it
the
will
end
be
of this
effective?
year.
By the end of this year.
By the end of
2018.
this year, that's 6 months from now.
We
Okay.
can do it.
We can do it.